Good afternoon. I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Urbana Public Health District, Julie Pryde. Good afternoon, Julie.
Good afternoon.
I would like to thank Jason Liggett for getting this set up. Of course, we're still distancing and we're not doing this in the same place. Thank you to Urbana Mayor Diane Marlin as well, and the City of Urbana and UPTV. Julie, let's start with the fact that no new cases were reported yesterday in Champaign County. Does this mean that social distancing and sheltering in place is actually working?
That's exactly what it means. Social distancing does work. That's a tried and true public health measure. Along with isolation and quarantine, it works very well. The issue is it takes about a week to 10 days to see the results of that. So we do know with the extended, stay home orders and people getting more used to it, it was working really well. And then came the holiday weekend, unfortunately. So we got a lot of calls this weekend. A lot of things were going on that do not fall within the stay home order or social distancing. So unfortunately, within the next anywhere from 3 to 14 days, we're going to start seeing cases probably associated with that.
I'm glad you brought up the holiday. Yesterday, a couple of local churches not only met in person, but decided to have drive-through services. Aside from the fact that we don't want people out driving because they could get in car accidents and then the police and fire are further taxed, why is that a bad idea?
Well, in general, there could be a number of things wrong with it. I think it gives the impression that it's okay to do that. I know that one of them that had the drive-in service, they did talk to us ahead of time to try to come up with ways to make sure that people stay in their cars, make sure that they're not picking up anyone else to bring them to the service, because that would be the vehicle would be definitely a way to transmit the virus. You're in there for an hour and you're in really close contact. So, in general, we don't want that type of stuff to happen. Everybody's constantly looking for loopholes around everything. But the reality of it is that we need to stay home as much as possible. And that includes, when you have to go to the grocery store, limit that to once every couple of weeks.
We're going to get to the grocery store in a second because I ventured out for the first time the other day. How many current cases do we have of confirmed cases in Champaign County?
Right now we have 85 confirmed cases. Of course, by this afternoon, that'll go up when we update our numbers. Even though we had a 24-hour period without any, which was nice. We will have some more this afternoon. So of those 80 cases, 2 of them, unfortunately, as you know, have passed away. And then we have 43 who have recovered and 40 who are still active cases. And when they're active cases, that means that public health is still following them. So they're in isolation.
We have, as you mentioned, 83 cases. It could be much higher if we're not having Illinois enacted social distancing much earlier. Would you say that our numbers aren't higher because we were one of the first states to adapt that?
Yes, I mean, that's the key with social distancing is you have to get out ahead of it. You have to, it takes a while to show the effects of it. It's obviously not something that's immediate, but yeah, that's absolutely, it has helped a lot. The other thing I think that has helped in our community is, people did tend to adopt this pretty early. There's some that don't do it, but for the most part, our community has been very supportive and looking for ways, to do this and make it work. So, I am thankful that we did this early and that we implemented some local measures that were a little harsher than some of the ones adopted even by the state. And luckily, the long-term care facilities took that very seriously and have been working on this since day one.
J.B. Pritzker set April 30th as the date that we shelter in place. The month is almost half over. Do you see that being extended at this point?
I do see it being extended. It will need to be extended because even the places who have really tamped this down, like South Korea, as soon as you let up on the social distancing, unfortunately, the virus is still out there. It's still transmitting. We did not have a nationwide shutdown. So even though Illinois has been doing a pretty decent job of it, that does not translate everywhere. And people are still, traveling, and people are still seeding outbreaks by not staying in their homes. So as soon as we loosen up on that, it will start up again, and we'll be right back to where we started.
So we don't know if there's another wave in the fall, if we're going to be doing this all over again.
Right. I mean, pandemics come in waves. I keep trying to remind people of that. So, with the first wave, it could be over, or it could be, waning by summer, because of all the social distancing and everything. But then it's very, very likely to start up again in fall, which of course is concerning fall and winter, because that's also pneumonia and flu season in general. So we will have to really, really be diligent about getting everyone their flu shots ahead of time.
We've been testing people who are symptomatic.
Mm-hmm.
Would the best solution to be have the number of tests that we can test everyone, and those who have the antibodies then can continue to go on the front lines and be out front, and those that don't then should just continue to stay home?
Well, I mean, it certainly would help with knowing who has had it and recovered. That would help a lot with all kinds of things, including modeling. But yeah, until we get an approved test that has been validated, then, we're pretty much stuck with what we are. And despite constant promises that there is enough testing for everyone who wants it, it's just not the case. And even the testing we have right now is not the best. It has a 30% false negative rate, which is not good. That's not a really good test. So between, the public health measures, which are like social distancing and isolation, quarantine, contact tracing, and just so you know, Champaign-Urbana Public Health District has continued that. We are not letting up on that. I know there are a lot of places who have. We're not doing that. We're going to continue that throughout this pandemic. We just keep adding more staff to do it from within our ranks and retraining people. But it is a very important public health measure. It's time consuming, but it's very important.
The CDC and you and I have talked about the fact that everyone who goes outside should be wearing a face mask. My grocery shopping experience was very traumatic on me the other day, because about 20 to 30% of people had masks on who were shopping, and most of the cashiers and baggers did not have masks on. And when I asked, I understand some of them were claustrophobic, it gets annoying, but it was a little horrifying to see. How are we going to get that across to people, how important it is?
Well, part of the issue right now is we still don't have enough masks. I mean, our community has been absolutely amazing in making masks. I can't believe how many masks that they're making. But, you realize we have 230-some thousand people in our county. That's a lot of masks. And you can't just go and purchase them at, a store like you used to be able to. But really, people should try to do something. Put on a mask, wrap a scarf around their face, something. Again, that is not protecting you from breathing in the virus. It's protecting everyone else from breathing in the virus from you if you have it. So if you get everyone to do that, it limits the exposure within a place like a store or someplace where you have to go. And it also helps protect the workers there as well, which is very important.
The aisles were not 6 feet wide, and yet there were 6 or 8 people wandering, touching food and things without masks on. Would you recommend at this point, if you can, order and pick up and don't get out of your car? Or can we still go into stores?
Well, I mean, certainly if you are a person who is at risk and you have an underlying health condition, or you have someone living in your home who does, or you're older, absolutely. If you can get the groceries either dropped off or pick them up or anything like that, do that. The more you can stay out of public, the better.
Julie, we talked about it earlier that there were church services yesterday. People are still getting together and having parties. I don't want to be a snitch, but I don't want this virus to continue making us shelter in place longer than we have to. Should we call the police if we see public gatherings? How should we handle it?
Well, the thing is, I don't even know if the police are going to do anything about that right now. The sad fact is that we have to rely on people acting like adults, and to act like an adult during a pandemic is to do what is the recommendations from public health, and that is to, at this point, to stay at home, stay away from other people. But there is this sort of magical thinking belief that we keep running into, that it's like, well, if I just have my parents over and I love my parents and they miss me, and if I just talk to my grandma a little bit, if they just come over and we'll maybe sit 6 feet apart. But it's just not worth the risk, because, people are dying from this, and people are having very serious outcomes and hospitalizations, and it's just not worth the risk. And I know people think too, even with like their colleagues, they think that you're an essential worker, you think you're only going to get infected by, a client or a consumer or whatever. The fact is, if you're still hanging around chatting it up with the coworkers, you're just as likely to get infected there as you are working with the general public. So it's really hard to get this across to people, and we do understand that it is hard. I mean, I get that it's hard, but I also get that it's super important.
Julie, members of the federal government are still promoting a drug that's used for malaria and lupus in order to cure, or as a virus preventative measure. Can you reiterate that there is no cure currently, there is no vaccine? Don't ask your doctor for any drugs for this.
Right. In general, I mean, nobody should be really promoting anyone unless they're a medical professional, and they get their information. I mean, I trust locally. Should I get COVID-19 and end up in the hospital in either one of our hospitals here, I know for a fact that our healthcare providers will be treating me based on what the most current and knowledge is, and the most current studies, and the most current information available. It is absolutely not a good idea to try to purchase up drugs and use them as preventative. The drugs that they're talking about have serious side effects. It's just not a good idea. I wouldn't suggest somebody do that for anything, whether it's COVID-19 or not. I mean, that's the job of the health professionals, is to treat us and to keep current with the literature, and definitely during this time they are especially. There are all kinds of studies going on for all kinds of drugs and all kinds of combinations and all kinds of, they're doing the using people who have recovered from the virus, they're using their plasma to treat. So there are all kinds of things going on, but they're going on in controlled studies. So that way you find out what is safe and what is effective. So we really need to just let the healthcare providers do their jobs, and not be pestering them about something we read on the internet. That's not helpful.
Well, now you tell me, because earlier I went down the rabbit hole of defending the fact that because we had no cases yesterday in Champaign County, what we're doing is working. That does not mean ease up on what we're doing, right?
That's correct. I mean, social distancing, isolation, and quarantine, those measures do work. But they, like anything, they only work as well as they're being practiced. We can only do so much at public health and the governments, the local governments and the police and everybody. We can only do so much. We rely on people to maintain their own quarantine, if you will, and to protect themselves, their families, and others, because that we can only do so much. And there are all kinds of things that people immediately want to get together for. And it's just not a good idea.
I'm worried about the mental health of all of us going forward from here. How do you maintain a good balance, you personally, between being terrified of what could happen, but being optimistic that what we're doing moving forward will help us get through this and we'll be stronger after that?
Well, what I do personally is I try to look mostly at our county. It's too overwhelming for me to look other places, and it's really overwhelming for me to think about this in terms of the entire world. And, when this gets into places that they can't social distance, I mean, social distancing is literally a luxury, and it's a luxury that even a lot of people in our community don't have. If I get sick and I need to go home, I know I have a room there that I can stay in. That's not the case for everyone in our community. So I try to just focus on what we can do locally, because everyone wants to, to be able to control something, and we can control our own behavior. Not so much our family. If I could control my kids' behavior, I would have done that years ago, but no, I'm kidding. They're good kids. But, we can only really control what happens to us, and then county-wise, I know the players. I know the all the levels of government. I know everyone who's working on this. I know my own staff. I know the hospital, the people working at the hospital. So we have really good, really conscientious people in our community. And so that's really what keeps me grounded, if you will. We have a great community. I've said this before we even had a pandemic. If you have an outbreak of an infectious disease, Champaign County is one place that you would want to be. And honestly, if I had to pick a place to be right now in the United States, it would be Champaign County. And it's just because, we know what's going on here. And even though we can't prevent everything, we do work really, really well together. And we have a really good community. There's some glitches out there, but for the most part, everybody's pulling on the rope the same direction, and that's important.
And we have not overwhelmed the healthcare system as of today. Is that correct?
Correct. Knock wood. We have not. It's been like we had hoped it would be, low and slow, if you will. So we're not going to prevent all cases, but if you can keep the numbers, going along, and even if you have a little spike and coming back down and going, that prevents the healthcare system from becoming overwhelmed. And like I've said since the start of this, I knew that the hospitals had plans. So that's comforting to know, and I've tried to communicate that with the public. The hospitals have plans. They immediately went into acting on those plans. They lowered their daily census in there, so they canceled elective surgeries, they canceled a lot of routine care, and then they were able to focus all of their energy on the issue of COVID and making sure that they had the capacity should it be needed. And beyond that, there's even more capacity should they have to open a surge facility that would be a shared hospital type facility. So we have a lot of bandwidth, if you will. So that's comforting to know too, because a lot of times in a pandemic situation, people are dying because they cannot get access to healthcare for routine things, such as a heart attack or such as a stroke or an asthma attack or things like that. So it's why it's so key to keep the hospital system from becoming overwhelmed, and they're doing a great job.
One question before I let you go. Mm-hmm. When we want to call CUPHD now for any type of COVID-related questions, what shouldn't we call you about? What are some things that your staff should not clog the phones by answering?
Well, the good thing is right now, if you have a general question about you need resources or you need somebody to help you with something, you can call 211 first. Our community has that, and we've been getting enhanced scripts to them, all the different agencies. So 211 is a resource to start out with first, and they can help refer you to all kinds of other things. Mostly what people are calling our COVID hotline for are, if they see people out, doing things that they're not supposed to do, we get calls on that. But we also get calls from people who are in isolation or quarantine who need stuff, or who have family members that are, or they need help. We're getting calls and communication in from the long-term care facilities that we also get supplies out to. But really, if you call us, it's fine. You call us, and if you don't, try 211 first. If you don't have success with that for whatever reason, go ahead and give us a call. We'll be able to direct you to wherever. But I think between 211 and there's some local things starting up just to help people, talk through scary situations, and that's good too. And there's a lot of people out there who are scared and who are anxious and who are just have a lot of questions, and they're getting their questions answered either by us or by their own agencies. One of the things that I'm very thankful for in our community is anybody that we've dealt with, from housing authority to senior services to people who have caseloads, just to ask them, whether they're therapists or whatever, reach out to your clients, reach out to your consumers, anyone you can reach out to, find out, just reach out, see how they're doing, see if they need anything, and that helps prevent something maybe from becoming a crisis. And our community's really done a great job with that, so I'm very grateful for that.
Let's start by thanking Urbana Mayor Diane Marlin. Jason Liggett is a fantastic producer, UPTV, thank you. But most of all, thank you, Julie Pryde and the staff of Champaign-Urbana Public Health District Thank you so much for all of your efforts.